Good morning to everyone. I have a wonderful guest today, Stephen East. He's the CEO for Caring People on the East Coast. And in Dallas, we are starting to feel the hit with the coronavirus. And I want to talk about what's going on. You know, home care agencies are the forefront. We're those front line, like the paramedics, like the police. We are the front line. And we're already starting to receive calls from family members who need help for their loved one that has been diagnosed or tested positive for the coronavirus. So we're talking with Stephen. He is a leader in home care. Thank you, Stephen, for being on today. And I just want to start right away. What is going on the East Coast right now in home care?
It's good to see you, Joe. I think the East Coast is a little bit ahead of where Texas is right now in terms of what we've been seeing as an impact of the coronavirus. You've seen a mass transition to almost a triage disaster preparedness mode over the last week. You've seen school closures, significant life interruption. We've had, curfews, transportation interruptions. So pretty much all the things that I think we take for granted on a daily basis have been impacted to one degree or the other by the coronavirus.
Mm-hmm. And how are your clients doing? Have you heard from your clients, and what's the information you're getting from your staff?
So this is the perfect storm for home care because our clients are the most vulnerable. Their needs don't change because of what's going on externally. So they still need to get the same level of help, if not more, because they have less connection to their family members who right now are unable to come visit. So we are very much intertwined with what's going on with them. We speak to almost all of our clients daily. My team members who have been working on the front lines, like you said, we're an amazing group of people. It's a real privilege and honor to work with them. Have distributed client names, and they're making calls from their home to make sure all the clients have all the goods and services they need. Our caregivers who have a strong connection to their clients, they're making sure that they can continue going. And that's, as of right now, as this is a fluid situation, we'll see how that transitions over the next few weeks. And we'll just have to keep navigating it. But so far, I think the team has done a tremendous job making sure clients are getting the services they need and that the caregivers have the support and the clinical oversight that they need.
Mm-hmm. And are you providing protective supplies for your caregivers and for your nurses?
Yeah, we provide all PPE, as you mentioned, which is getting more and more challenging as the supply shortage is much more obvious now. But we did in advance stock up as much as possible. And we're hoping that there'll be some sort of relief on the supply side so we don't run into a situation where we don't have any.
Mm-hmm. How's the morale of your caregivers and nurses?
I think that they're having this challenge and they're rising to it. I think it's giving them like some renewed energy and being really appreciated for what they're doing. I think it's given them kind of a little bit of a jolt to go out there. We have nurses who are on the subway system in New York City going to see clients up until a day or two ago. So, they're committed and they understand that we all went into healthcare for a certain calling, and they're kind of hearing that call right now.
Mm-hmm. I know some of the staff is terrified to ride on public transportation right now, and I understand their fears because this virus is spreading so quickly. So what are you doing about if your caregiver is not comfortable riding public transportation? And we don't have that issue. Most of our caregivers have cars. So how are you handling transportation?
So where we're able to, and if they're able to use Uber, we're subsidizing all Uber costs during the foreseeable future. The other thing that we've done is we've had our own caregiver transportation system for the last 8 months. So we actually have a fleet of vans that take our caregivers to and from work every day. So we're able to cope with it at this time, and hopefully it'll be able to support the further demand going forward.
And what about let's just say you've got a client that needs to see the doctor. For us, we're encouraging that telehealth. What are y'all doing about doctor's visits for clients?
Yes, we've actually been doing the same thing. We've been using different two-way video platforms to put the clients in communication with their physician and with our clinical team. We're strongly encouraging everyone to stay at home unless it's an emergent situation. So even routine doctor visits, we're saying you should cancel it and wait until we have a green light to go out. So the most important thing for our clients is to stay where they are and stay away from congregant situations.
Do you have any clients right now? I know we can't violate any HIPAA, but I know you cover 4 states: New York, Connecticut, New Jersey, Florida, actually now 5, Texas. Have you had any clients test positive for the coronavirus?
We haven't had any direct positive tests on any of our clients. We have had clients who were in direct contact with individuals who did test positive. So we're treating that as almost a positive test, and we're advancing those protocols in that situation, such as self-quarantine for the caregivers and for the clients. We haven't had anyone come back positive yet.
That's good. That's good. And I know that it's probably going to be inevitable. And you and I talked about 30 minutes ago, we got our first request for nurses for someone that has tested positive for coronavirus. And so we talked about that. How do you feel we handle someone that's sick and needs care, but they have tested positive?
So one of the things that you and I even discussed, the idea that we practice universal precautions is this concept that if we follow that protocol, regardless of someone's how they've tested or if they're positive or not, we always treat them the same. I think when during the HIV days of the 80s and 90s, this was a very important protocol to adhere to because you found so much fear and people were scared to take care of those individuals. So there was this kind of advent or of this universal precaution protocol, and that's what we're adopting for cases here if they are testing positive for the coronavirus. Practice universal precautions, take as many necessary steps as possible, and try to eliminate as much risk as possible.
And that's a good thought. I graduated from nursing school in 95, and I started working at the county hospital when I graduated, and that's all I took care of was AIDS patients. And we did not know very much. And I remember washing my hands so much they would bleed. I washed them so much, and we had gloves as well. But I'm feeling that way too. So, I even carry my hand sanitizer with me. I've got my alcohol swabs, and it's just important, good hand washing. One thing I read today about prevention, and the average person touches their face 16 times a day. So when you touch a cup, you touch a pen, you touch a door handle, you're touching other people's germs. So really pay attention to how much you touch your face. You pull your hair behind your ear. You're touching your face a lot. So it's so important to try not to touch your face and just stay clean and have those universal precautions. So how can we help, Stephen? If somebody said, hey, I don't want to do patient care, but I know you all need help. What can the public do to help nurses and caregivers that are on the front line?
That's a good question. We're kind of like in that catch-22 where we want to keep ourselves isolated, but there is sort of a sense of community now that's arising through this crisis. And I think that the eyes and ears of individuals who need help is still coming from the community. I would recommend that if anyone sees someone, a next door neighbor who's a senior who they're concerned if they're able to get out or not, reach out to a local home care provider. Call, Caring People, we're available 24/7. If you call us, we'll be able to kind of intervene unless it's an emergency. Then obviously you call 911. But I think what you see here is like this kind of coming together of community to help support each other. And there's a lot of resources out there, and people are stepping up. And I think the home care provider network as a whole and as an industry is available and ready to assist in the situation.
We had a patient that just was craving bologna cheese sandwiches and asked one of our outreach leaders if she would please just run get bologna and cheese, and it made her day. And just she likes to stress eat bologna and cheese. So it's just the little things. We have neighbors that are elderly, and I have a group chat of people that live on my street, and we're helping each other. I have chickens. I have 9 chickens, and so we're passing out eggs to all the neighbors, which is kind of fun. But just being there and being a help it just makes such a difference. I'll tell you, in Dallas, Mark Cuban is providing care for healthcare providers, so frontline for, care for their children, so providing child care. And so those that have to work, but the kids are home from school or want to work, he is providing care for those workers, which is really awesome. So, how are you preparing your staff out in the field now? Like, are you doing a daily call, or what are you doing to keep everybody calm?
Yeah, I don't know if we're keeping them calm, but I think we're keeping them focused on what the task at hand is. We have morning, afternoon stand-up calls. We go do a complete roll call of their assigned clients, so we know who they're responsible for managing, who the caregivers are assigned to those clients, so we get a complete picture as to what's going on. We're in communication with the families. We've brought out tablets to clients to set up two-way video so they can talk to their family members who are not able to see them. So we're doing a lot of things to make sure that at no point in time are people not supported for what's going on out there.
Right, whether it be toiletries, food, prescriptions. Sometimes people need a refill on a prescription, and just those simple things can make such a difference. Okay, one thing in Dallas, we are seeing a big rise in requests for nurses. There have been businesses that ask us to have a nurse on at the front door and just checking temperatures and just answering general questions to employees. And that's been a wonderful program. We are utilizing a lot of our nursing staff to just help ease the calm, allow calm in the community. So one thing we've heard here in Texas, and I'm sure you've heard up on the East Coast too, is we need to avoid going to the ER. So if your clients have symptoms, Stephen, what are you all recommending that the client do?
Well, first thing is don't overreact, because a lot of individuals who may have some symptoms that they resemble the flu should just not automatically assume that they've contracted the coronavirus. So we're doing a more regimented temperature check. We're making sure that we go through the standardized questions with every one of our clients. If we go through the entire process and we're still concerned, that's when we will advise to having a test done. If you can avoid going to the ER and can have a test done at another location, I know they have drive-through testing now. We strongly encourage that. It's the old adage that the last place you want to go when you're sick is the hospital, and that's even more true nowadays. So anything that we could do until that point where we feel you need to go to the hospital, because that's the safest place for you.
Most definitely. Okay, one thing that we recommend to clients that want to see the doctor but can't get out, there are services, Doctor on Demand, and Plush is a telephone doctor. I think it's $99, maybe $109, and you can try to get reimbursed by your insurance. So if somebody needs to see a doctor, they're concerned, that is an option as well. And you're not going anywhere. You're not exposing people or being exposed. Um, another thing is just talking about our clients with Acappella in Dallas. We have people for private duty are paying out of pocket. Medicare does not pay for the service that we provide. And a lot of people get confused that think that Medicare is going to provide the activities of daily living, bathing, med reminders, light housekeeping. And not everybody can afford $20 to $25 an hour. There's some agencies that charge a lot more than that. For Dallas, it's roughly $20 to $25 an hour. So you have a program called Caring on Demand. I think this is so awesome. Tell me about Caring on Demand.
So I've been involved in home healthcare now for over 20 plus years, which is hard to believe. And one of the consistent messages I've heard from clients is that I don't need to have someone in my home for 4, 6, 8 hours a day, even though that's what was logistically the easiest way for us to service them. And they said, well, the person's just sitting around after they help me with my activities and they're watching television. Mm-hmm. So we said, is there a way to break down care to just the lowest possible increment, which is by the minute, and just use the care that you need, and then the caregiver could go ahead and take care of another client. So we developed a technology platform that allows that to happen. So clients can request care, their family from afar can request care, caregiver could assume that request, go in and service the client and follow the client's care plan that's designed by a clinician, and then the caregiver goes on to their next client. And this allows clients to reduce their out-of-pocket home care spend. It also allows the caregivers to earn more money, which is a very important factor in this space. And so Caring on Demand has definitely been a tremendous advantage for caring people and all the other providers in our Caring on Demand network to be able to access care affordably and in real time when you need it.
Mm-hmm. That's awesome. And I know in Dallas and Fort Worth, that is available in Dallas and Fort Worth, and in all of your other communities, correct? So
Yeah,
people can reach out if they just need a little bit of care. That's awesome. So how can we as Texans help you guys on the front line on the East Coast? What can we do to help?
Send us some good steaks. I think that's what we need the most here. All the grocery stores are closed.
Well, the grocery here has chicken thighs for 69 cents a pound, and I bought about 20 pounds for my husband to grill. So I came home with a ton of chicken.
You're a chicken farmer. You know if that's a good deal or not. Look, I think that what's come about through this crisis is that there is now this collective collaboration between healthcare across state lines. I think New York even just passed it. If you're a caregiver from another state, you can work in New York right now, even though in the past you need to have New York specific certification, because we understand that now this is a bigger issue than any state borders. And I think that we've seen that. I've spoken to folks out in California, Washington, Colorado, Texas, of course, and we're all kind of collaborating on best practices. What are you doing for your caregivers and your clients? And we kind of have those conversations. So I think we want to just keep that collaboration, communication going, and I think that'll get us through this.
Mm-hmm. That's awesome. So, and that's one thing for us, we're in the South and I'm in Texas and I have a strong faith. And I just encourage to pray for one another, pray for our nation. Like me, I love being a nurse. It's my calling. I get no better joy than being at the bedside of a patient, holding their hand. And we want to be there. We want to serve, but we want to be protected as well. We don't want to get sick. And so we want to do everything we can to stay healthy and provide that care. So just following those, wash your hands, social distancing, wash your hands, cover your cough, and most important, stay calm. And we're all, as a nation, every state, county, city, we're all working together to try to combat this and get through this together. And it's amazing what a community we have in our nation.
Definitely, especially the healthcare community. And maybe one of the things we should do is probably watch a little bit less news. I think every time we turn on the TV, we kind of start seeing the numbers go up, and I think that's creating additional anxiety. This is something that's going to keep evolving. We're going to continue to see the numbers rising, but we're also going to start seeing the number of people who recovered also keep going up. So keep calm, do your thing, follow your local protocols, reach out to the healthcare systems when you need them. And hopefully in a couple of weeks or in a month, this is something that's in the rearview mirror.
And just reach out, see what you can do to help. And just, it takes a village, a community. Thank you, Stephen, so much for your time. You have a great organization. We love being a part of it. And we're working together to do the best we can for our patients. And thank you for your time so much.
Thank you, Joe. Always a pleasure.
Take care.
Bye-bye.